So I want to talk a little bit about PTSD, especially coming from the massage therapy side of things. Now, disclaimer: I am not a licensed. First of all, I'm not a licensed massage therapist. I am still in school. I am on target to graduate in September of 26, and I also am not a licensed therapist. But mental health, trauma, those are areas of education in the life coaching area. And so I've had some informal training in that department. So that is, I'm literally just making a video pertaining to how could massage therapy come into play for someone who is experiencing PTSD. So, first of all, PTSD, post traumatic stress disorder. You may have recently, I've actually even heard of PTSS, which is post traumatic stress syndrome. And if I understand this correctly, I believe that the PTSS is more of the beginning stages after somebody has experienced something traumatic. It's kind of that beginning stage, maybe within the first 30 days. And then if things continue beyond that, their stress responses and the symptoms that come along with that continue, then it I'm assuming that it then is considered PTSD, the actual disorder. So PTSD, we're just going to talk about PTSD. And that's, again, that's going to encompass both of those regardless. So what this is, after a person it's a mental health condition that people experience after maybe a traumatic event. And it could be like a natural disaster. It could actually be somebody holding them at gunpoint, being in battle, like being, in the military. It could be, some sort of physical assault. So there, that's kind of like a singular event that has happened. It could be a season of traumatic events. It could be a season of a pattern, a very unhealthy, toxic pattern playing out. So somebody who was maybe, abused as a child, and that went on for several years. So that, there are many different things that a person can experience. So one of the determining factors of how well a person may recover from those traumatic event and get toward healing and those symptoms, and we're going to talk about symptoms of PTSD, as for those to subside. One of the determining factors is, first of all, how well were they doing prior to, how much of a support system, how much of a how well did they take care of themselves, what kind of mental health were they in prior to either the event or that season. Okay. And then also the next would one of the big factors is how old the person is. Was it a child? Was it an adult? And then also after the fact, how were things handled? how much of a healthy support system did that person have? Were things properly dealt with? Were they swept under the rug? Those kinds of things. So those are three, uh, very big determining factors of how how the PTSD will play out, how quickly they can heal. Are they, are they in an environment that is conducive to that? So let's get into symptoms of PTSD. You may have heard of the term flashbacks. What's actually happening is, and again, let me throw a disclaimer out. This is only from informal education that I have had. This is not to diagnose anyone. This is not anything formal. This is just stuff that I have learned along the way. And now that I am, bringing massage therapy into the mix, this is something that I will absolutely be encountering. So I am grateful that I have trauma informed coaching, that I have mental health coaching. But again, I am not a therapist. So again, any of this stuff that I am saying is just some general information that I've picked up along the way. There are professionals that, if you believe that you need to talk with someone, there are professionals for that. So, anyways, some symptoms, we've flashbacks. This is, of my understanding, where a person is actually reliving the sensations, maybe a smell. You've probably heard of the word trigger. There's a certain smell, or there is some piece of their memory that will trigger this flashback, and it's like they are right back in time in reliving that moment. And so the very stressful part of this is that the body is still experiencing something from the past right now. It's not differentiating, oh yes, I remember that happened then. It's like it's happening again, all over. So people can have, this can also play out in nightmares. Obviously, just general anxiety, probably depression goes along with this. They have, it will end up impacting choices. And so they may avoid certain places, people, activities, whatever, that because they're trying to avoid anything that might remind them of and trigger them, and that they are going to experience those things again. So it can really disrupt life, relationships. This can be a very invasive mental health challenge. So along those lines, then when it comes to coping with it, there can be, I mean, obviously addiction is very possible. Again, losing interest in certain things that they have had interest in after a time. Just so it's kind of like it can be the sooner and the healthier things can be handled toward the beginning, the better. And of course, as things are, potentially swept under the rug, not really talked about, and then these symptoms start to accumulate, they start to amplify and get bigger and heavier and more complicated, and so on and so forth. So ultimately, of course, I'm sure it's not a shocker that potentially thoughts of taking their own life can start to come into the picture. So again, the best, healthiest way is very, very early on, as soon as possible, as healthy as possible, to to work through whatever the traumatic event or events were. So some of the, we did mention the, I keep saying event or events. Okay, what are some of those? And I had mentioned a couple already, but it could be something like a natural disaster, a car accident, something where the person is unsure of their survival. Like they are not sure if they are going to survive. It can be, like I said, a physical assault, being held at gunpoint, terrorist attack. I mean, it can be a number of things. So anything, and I think also one of the really big factors in that is, was this person able to fight, so to speak? Like, did they have options? A lot of time those options are taken away and the person is at the mercy of whatever is unfolding, and that is what that that plays a, from my understanding, that is one of the big factors that plays a role in how this will unfold and what the aftermath impact is going to be. But that very particular thing of them not really having the ability to fight back in whatever capacity and whatever type of circumstances that were unfolding. So pertaining to massage therapy and how this could be beneficial for a person who struggles with PTSD to whatever degree. First of all, massage is to be, professional massage therapy is to be safe touch, appropriate touch. So this, and it obviously is to be relaxation. It is to be able to work with the muscles and the nervous system in general, creating an environment where the body can relax, where the muscles can relax. That is obviously the point of that is to bring any pain relief, tension relief. So again, for general relaxation. It also very much depends on the maybe the vibe with the massage therapist and that client. So when that client just feels safe with that person in general, they just feel a good connection with them. They feel very safe with the massage therapist. That also plays a part. There was a saying that in real estate, when I was in real estate, that a person doesn't care how much you know until they know how much you care. So applying this to massage therapy, even the best massage therapist, they know all the anatomy, they know where the muscles attach, they know all the stuff, and they know how to make this muscle do this thing, and try, they can work magic. It doesn't matter if that client does not feel a good, safe connection with that, an appropriate connection with that massage therapist. So So it's really that being able to create that entire environment. Um, this also, I thought about how some people, again, in some of the informal education that I've had, have along the way maybe shut off like body sensations. They may be kind of numb, not really aware of their body anymore. There are some things with that, and so this very well could be a way of helping them get back into a more aware, more in tune state with their own body. Um, Also, it can help with when you're stimulating the vagus nerve, that there's a very long nerve that runs from the brain down through the body. You can stimulate it by humming, singing, belly breathing. So when you're stimulating these things, a massage therapist can work the diaphragm muscle, which is kind of like up around, like inside the ribs. um, y'all can practice some belly breathing together. That is something that I like to do with the people I'm practicing with. Belly breathing, they actually teach it to people going into combat so that they can remain calm and be able to still think clearly when they are in battle. And so that is definitely something that I mean, it's free. You can do it anywhere at any time. Nobody even needs to know necessarily that you're doing it. It's such a powerful, powerful tool. So that's something that you can help the massage therapist could help that client to just get some more steady, deeper breathing down into the diaphragm, not just the chest breathing, like that hyperventilation sort of very shallow breathing. So this helps to shift some. You've probably heard of the term fight or flight. That is the sympathetic nervous system. But when you can help someone to shift over into the rest and digest is the other part of that, the parasympathetic nervous system. That is where again, rest and digest. That person can calm down. That person can their digestive tract will function a little better. It will come back online because it feels safe. So there are there are so many benefits to being able to there's aromatherapy. um, so there's just a number of benefits. Now, if depending on the person's uh, history, the events, how long that had gone on, all those factors. How much healing have they done? Have they not gotten any healing? Where are they in the whole process? What are some of the possible triggers that they have? Possible very uncomfortable situations, areas of touch. If somebody had been assaulted in a very specific way, of course, that area of touch, maybe having where you're behind them, or that maybe they have to start with, let's maybe just massage hands, and start to build some rapport and some safety. Maybe it's literally just that. Maybe it has to start out with a chair massage where the person is fully clothed, and where they're still able to have some relaxation. There's still some good work that could be done. But maybe it needs to be done in that way. Maybe they don't want to hear particular music. Maybe they don't want to smell a certain smell. You just it just really depends on what what they have experienced. So those are things to, to maybe just ask ahead of time. Hey, is there anything that you can think of that may be of a concern for you, before we start? Is there anything, and maybe just ask some general questions. Of course, you're not going to necessarily get into the nitty gritty of details and whatever. But if they can share some, maybe some general something, and have some options of different things that can be done. I actually just talked with one of my potential practice clients who is experiencing some concern for this very reason. And so I made sure that I said, hey, I just want you to know that there is no way, no specific way that the massage is supposed to be. We can make it whatever it needs to be so that you feel safe, where you are actually getting the benefits of the massage. We can, I'm a professional problem solver, I say. I'm like, I can really come up with some very strategic, thinking outside of the box ways that we can go about doing this, so that you can still experience the benefits while, while we bypass some of those triggers. So maybe, and again, just having some sort of general plan. Um, Maybe asking, uh, okay, if we accidentally run into something that is a trigger, maybe they don't even know that it was going to be a trigger, wasn't even on the radar. How will we handle this? Let's have like some sort of, where you like, is there a safe word, and you can tell, so that I know, okay, something has happened. We're going to go into our in case plan. So there could be things like that. So let's say, for example, somebody, the client, you notice that they, uh, and I'm going to actually choose, for example, let's say I'm a licensed massage therapist. I have gotten my license, and I have a client, and he's in his 40s, and male, obviously, and we're going through our process, and I realize that he is starting to cry. This could be happening for, a couple of different reasons. So the first thing I would want to do is, I'm not going to like freak out and leave the room and leave him to himself. I am going to like remain present. I am going to gently acknowledge that, hey, are you okay? Is there, and you just start to have that conversation, to gently ask him, is it something specific? Do you, how about we take a break? Do you want me to bring you some water? Do you, let's sit up. Let's, make sure he's all covered and secure. And let's just have, let's take a little break and figure out what needs to happen. Maybe there's actually a book called the Body Keeps Score, and our trauma is actually trapped in our bodies, in our body. So it could have been, I mean, he maybe wasn't even thinking anything, and then all of a sudden he's starting to cry. That could have been just some of the emotional release from, the like from a muscle that was, just some tension that was relieved. It could be that he was actually thinking about something. Maybe he was being triggered, but is embarrassed and maybe didn't want to say anything. But there's different reasons that this could be coming about. So, but the most important is to not leave him in that, is to be an appropriate, safe presence, and just gently collaborate with him. Okay, how do we want to go about doing this? And I say that, okay, let's say he was a guy. It may be the things that I say or do, or how I remain in contact, may be different because he is a man versus if I had a female client or one of my friends, or so this is really where our own growth, our own emotional intelligence, and maybe our own journeys of healing will help us to be able to more appropriately show up along the way during these times. And again, this could be in any profession. There's so much. There's trauma in some level, at some level, for just about everybody. And so just being aware of that is key. So I appreciate your support. I appreciate you listening. And if you have any questions for me, please reach out. If you feel like you would like to get in touch with a professional, but maybe don't know exactly how to do that, I can absolutely help in that department as well. And I can still be the cheerleader slash coach slash professional friend alongside too, as you maybe make that journey with the professional. So thanks for listening in, and as always, if you know me, the soul is the goal.